Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host for the Dean's Chat podcast. I'm here with my co-host, Dr. Joanna Richey. Hi, Joe.
Hey, Jeff. How you doing?
I'm doing wonderful. Hey, we've got an all Arizona College of Podiatric Medicine group today. So welcome to
Woohoo!
Dean's Chat, Dr. David Jenkins. David's a two-time Dean's Chat participant, if you will, veteran. So welcome, Dr. Jenkins.
I'm so glad to be here. It's a blast to do this. It always is.
Fantastic. You know the drill, Dave. We're very informal, so it's Dave and Joe and Jeff.
Sure.
All right, so we've worked together since I got to Arizona 7 years ago, but you've got a long-standing history at the Arizona College of Podiatric Medicine, back to when it was the Arizona School of Podiatric Medicine, and even before that, it was the Arizona program. Can you give us a little trip down memory lane and how we've got where we are today?
Sure. We can talk maybe about my previous job up at Des Moines University, but I came from Des Moines, and Dr. Paige, as you know, who was the founding dean, invited myself and Dr. Freeman, who was also faculty at Des Moines, to come down and help him start this new college or new school, as you say. And that was 2005 is when I joined the team. Denise and Jeff were already up and running, getting things going. The very first class was enrolled in 2004. So I had a chance to work with all classes pretty much. They were second years by the time I got here. And I've been able to see all the incredible changes, like you say, growing from the school to the college. And I remember when you came in about 2017, and that was, it was so sad to see Dr. Paige go because he was just a phenomenal person as well as a great dean. But when you replaced him, there was no loss in greatness. So that's the way I saw it.
You're very kind. You know, Dr. Paige was my mentor. He was the clinical dean when I was a student in California.
Mm-hmm.
So
he was a student at the California College of Podiatric Medicine when I was there. He was, I think, 2 classes behind me. So we would have been the exact same class, but I think he did his LDS mission, and so that's how he ended up a couple of years behind. But I didn't know him very well, but I saw that he was very, very active student at CCPM.
Oh, he was a mentor for me. And Joe, you know Dr. Paige.
Yeah, absolutely.
He was your initial dean, and when you graduated, you've seen a lot of changes too over the years.
Yeah, it's been really remarkable. So I came in the same time as Dave did, on completely different sides of the spectrum there. But I remember you had just moved, Dave, when you had gotten when we were there, and you were talking about the move and the things you were excited about doing in Arizona. And we'll talk on some of the things that it's been fun to watch your career flourish in Arizona with all of the different things that you're involved with here. But yeah, Dr. Paige was just, again, you've had him on as a guest, and he just the epitome of a professional, just a true gentleman and just an absolute professional. When I was trying to figure out what I wanted to do with my life, I did my undergraduate degree here. And so I had gotten to come and just talk with him because I saw there was this program that was starting. I didn't know anything about podiatry, shadowed a couple different docs in the community and went and talked with him. And then it was just like, yeah, I'm sold. This is exactly what I want to do. So can't say high enough things about Dr. Paige.
Yeah. And Jeff, one of the things that I was first tasked with, I was still living in Iowa. I was working at the VA at that time in Iowa City. And Dr. Paige sent me, he says, we want to have a sports medicine course. So I designed that whole course, put it together. And it's not something that at that time we were doing at Des Moines. And so, and of course, that's my special area of interest. So that was a joy to be off site and actually be working before I actually started working, which was March of 2005.
So Dave, you've always been involved in sports medicine, and you were an active runner. You went to UC Davis. You went to the California College of Podiatric Medicine. Talk about your interest in sports medicine, because that's really propelled your career.
I would love to. And the students, and third-year students now are going to go, oh, no, we've heard this story already. Because I did this story in the sports medicine course, which is really a lecture on the history of sports medicine as it relates to podiatry. And of course, I couldn't not tell my story as part of that, because it's how I got into this profession. And long story short, I'll try and keep it short. But I was at UC Davis, third year at that college, and I had no idea what I was going to do. I looked at every conceivable, especially dentistry, medicine, physical therapy, pharmacy, everything, optometry. And I saw an ad for a conference that was going to go on in San Francisco. And it was kind of the runner's dilemma. And it was put on by a whole host of specialties that were involved in treating the runner. It had some very, very famous orthopods. It had, of course, Steve Subotnick and Harry Levesque, the famous podiatrists in sports medicine, were there. But there were chiropractors and primary care docs, just a whole potpourri of physicians there. And I went to that. And I was blown away by who are these podiatrist guys. And I learned about that they were not only able to do surgery and prescribe medication and do all the things that the physicians were doing, but they were also heavily involved in treating runners. I've been a competitive runner since 5th grade. I still consider myself competitive. And so that's what I really wanted to do. So that's what really grabbed me and put me in the profession, was being able to see runners.
And then you took on leadership roles within the profession as president,
Mm-hmm.
the American Academy of Podiatric Sports Medicine. How'd you climb up to that level? I mean, was that like a process, or?
That's interesting because I was a member, just, bona fide member of the Academy. It's something I felt I needed to do. Ironically, I didn't join until I came here. The sports medicine was such a bigger deal for me here than it was at Des Moines. Des Moines was more of a surgical experience for me. We had a crazy county hospital scenario where we treated gunshot wounds, calcaneal fractures, everything, all the crazy stuff. It was great. But when I got here, the clinics I was involved in weren't so much involved in that kind of activities. So the sports medicine became a big part of what I did. And so I joined the Academy. And then I think what kind of got me going in the process of becoming the president eventually was research. And because it's just something that they were very interested in promoting and getting more done. And I was doing some, and then I was able to present at some meetings on, research and case studies, whatever. And so eventually got in the loop to work through the I guess, executive board and all that kind of stuff. And I was president for almost 2 years, because one of the presidents I took over for, he actually left early for practice reasons and stuff. So I had almost a term and a half. But and since then, it's been a tremendous vehicle to help push Special Olympics. In fact, right before this Zoom call, I was on a Zoom call with Special Olympics person that's kind of oversees fit feet at the world level. And she and I are presenting at the Academy meeting in I guess, the end of September. She'll talk about Special Olympics in general, and I'll talk about some of the research that we've done in Special Olympics that we're trying to help drive how fit feet is carried out. And
so you jumped ahead of me just a bit, Dave, because
sorry.
That's okay. No, I love talking about Special Olympics. Like, don't be humble now. You are at the upper echelon of clinical advisors through globally, correct? With Special Olympics. And you've been all over the world with Special Olympics.
Yep. Been to 8 World Games in a row.
Wow.
And haven't missed any yet. The next one's going to be in Turin, Italy next year, I believe, for the Winter Games. And so, yeah, it's been an opportunity for me to travel, because, as we get a little older, that's one of the big things we like to do, is travel and see the world. And it's been my chance to do that as part of Special Olympics. So it's kind of a win-win. And my wife Julie goes to some of these events, and some she doesn't, but it's just been fantastic to meet all these individuals from around the world who are like-minded and have a passion for Special Olympics and caring for persons with intellectual disability.
So, Joe, do you remember taking courses from Dr. Jenkins?
Oh, absolutely. I still have in that folder down at the bottom, I still have notes from Dr. Jenkins' class from a long time ago. And actually, what I think is also so remarkable is I remember when you were invited to do that very first Special Olympics, and we were a group that got to go with you as the student group. And so over the years, watching you just take on leadership roles at higher and higher levels, again, it's just such a neat thing to watch. Your mentors continue to grow and learn and develop, and something that I remember that very first one. And so can you talk a little bit about kind of how that transition looked for you when you started?
Sure. I was going to bring that up because you were in the very first Special Olympics event I did. But how it got generated was as a podiatrist down in Tucson, who's retired now, but he just, all the main events were in Phoenix, and he had to come all the way from Tucson. He had no students, he had no help, and he just finally reached out to me here randomly, because I was not involved in Special Olympics, and said I could really use some help. So Joe and a bunch of her classmates and I headed out to Holcomb Park in Mesa, where the Cubs used to play, and with Dr. Friedrich, his name is Dr. Friedrich, and we did the first event, maybe saw 20 or so athletes, and that's how it got started. And I fell in love with it. I said, I want to do this. I want to be the clinical director for Arizona, like Dr. Friedrich was, and I knew he was going to get ready to retire. So ironically, I did my clinical director training at Iowa State, which I just came from, so that was kind of interesting, and got to stay in the dorms at Iowa State and with a whole lot of other people, not just for Fit Feet, but all the other disciplines. We're creating clinical directors. The other thing about that get together was it was the very first USA Games for Special Olympics history. So I've never missed one of those either. And so I got trained. I was a clinical director. Since that time, I've trained maybe 50 to 100 other clinical directors in my role. And it's something that's just been the greatest joy. And the person that started Fit Feet as far as what we call the global clinical advisor was Pat Noonan, who you may know, Jeff, and maybe Joe too, I don't know, but he was the first global clinical advisor, and he kind of started Fit Feet way back in the day. I think I mentioned this when I spoke about Special Olympics before. Anyway, he retired in 2018, and I took over for him as the global clinical advisor. With COVID happening, a whole lot of big changes occurred with Special Olympics leadership. And so we've been changed from the global clinical advisor to the global faculty advisor, which is the exact same thing, except we don't get paid. So it's no longer a paid consultant, but we do the same things. We advise the people who oversee all the Special Olympics things. We advise them in our special areas. And it's pretty nice. I can do a shout out to Suzanne O'Neill, who's a physical therapy faculty here at Midwestern. She was named to be the main person overseeing a brand new program that primarily involves physical therapy called Fun Fitness. So we have a great connection here at Midwestern, and it's maybe a nice segue that we have every single discipline represented here at Midwestern except audiology. And I know Dr. G has talked about doing that eventually, but it's really nice. And Jeff, you've been to some of the Breakfast with Champions, and you can see some of the Midwestern people that are involved.
Dave, if you don't mind, I think one of the favorite stories I've ever heard you tell is the origin of Special Olympics. Do you mind sharing that with our listeners?
I can. It's not as fresh in my mind as it was when I did this with Alicia. I think I reviewed it pretty closely. And but generally speaking, Eunice Shriver Kennedy, who is the sister of JFK, she had a sister, another sister of JFK, who was intellectually disabled. And this was back in the 50s, 60s, early 60s. And she saw how difficult it was for persons with ID at that time to fit into society at large. They were just shunned and discriminated against and thrown into institutions. She was able to keep, her sister at home because they could afford it and all that. But it was such an impactful thing for her that she decided to come up with a way for persons with intellectual disability to get out in the world and do stuff, and especially sports. She was always been very sports minded. So long story short, she started essentially Camp Shriver, which was at their compound, the Kennedy compound. And it's where all these individuals who, again, had intellectual disability, Down syndrome primarily, would come out to Camp Shriver and just do a whole host of activities, volleyball and swimming and horseback riding, whatever they could put together. And it was an absolutely fantastic experience. And I remember Tim Shriver, who's her son, who's now kind of oversees Special Olympics. He was just a little boy there. And he told a story at the Breakfast of Champions, how he was just like looking, who are all these people coming to my house? And so he saw it from the very beginning. But in, I think, 68 is when she actually had the first Special Olympics event in Chicago at Soldier Field, the old Soldier Field. And that's how it started. And so the next big step that came along was when she would take her sister to get healthcare and went to the dentist, and essentially the dentist said, well, she has intellectual disability, we'll just pull our teeth out and make it easy for us. And she said, that's not going to happen. So she found a dentist who was kind of specializing in pediatric dentistry. He says, we don't have to do that. And essentially treated her very kindly and took care of the problem. And he ended up being the first person to start Healthy Athletes. And that was, I don't remember the year of that, to be honest with you right now, but that's where they came up with disciplines that persons in Special Olympics could go get their teeth checked and their eyes checked and their feet checked and all those sorts of things. And so that's kind of how it got started. And Healthy Athletes is what we participate in. Fit Feet is a part of Healthy Athletes.
Were you going to transition into talking about your curriculum additions with intellectual disabilities? Is that where I cut you off? I apologize for that.
Say that again, the what sort of?
Your initiative for new curriculum around intellectual disabilities.
I'd love to.
Okay.
And Stephen Perlman was the name of the dentist that escaped me for a quick second. I wanted to do a shout out to him because he started the whole thing, and he was the pediatric dentist. And these things, as you know, they come back in your mind after you can't remember them. So, but the curriculum, what we've done at Midwestern forever, as long as I've been involved in the pediatric ortho course, is we have essentially congenital deformities, congenital problems, and we cover all the things, including Down syndrome, Prader-Willi, Fragile X, cerebral palsy, about 15 or 20 of these. It's a 2-hour lecture, but it's all about pathology. And there's nothing about communication. So what we ended up doing is looking at this and how can we make this better? And this was kickstarted by when Alicia, who joined me for the first thing on Special Olympics and Dean's Chat, asked about doing a project on Chris Nikic. Chris Nikic, as you know, is a young man with Down syndrome that did an Ironman triathlon. And so how does someone with those challenges, both behavioral, emotional, physical, mental, complete probably the most arduous event in sports. And so in the process of researching this and talking to Chris Nikic's dad for about an hour and a half on a Zoom call, which was absolute bliss, we learned so much about how medical professionals at large are really bad about caring for persons with ID. They don't want to, they don't know how, they have no training whatsoever in school. And this is when I say medical school, it's like all schools, all healthcare provider schools. So we decided we're going to change that here at Midwestern. So we interviewed every single program in college and found out, what are you doing for training your students for intellectual disability? And so long story short is we came up with a whole host of things that these programs and disciplines do that involve mostly communication and accommodations. Like you wouldn't believe all the things dental does to accommodate for persons with intellectual disability. So they do a lot of scary things in dentistry. Most people don't like going to the dentist anyway. Imagine, and this would include things like autism as well, which is not really the push of our project, but it's certainly in that category.
Joe, you've been a faculty member now for a couple of years, and was it amazing to you to see all the curriculum reviews that happen all the time and what goes on behind the scenes, behind the courses, like Dr. Jenkins, Dave's talking about?
Absolutely. And again, this is also one of those, I think, really unique areas that I'm so glad that you championed this project, Dave, because again, it's obviously has direct correlation for our profession, but then being on a campus that is so multidisciplinary, where you can develop a curriculum and share it and innovate with each other. Oh, that's so interesting. Tell me more about how you accommodate for that. Because we do procedures in a clinic too, and maybe things that they're using would be really useful. So I think that is such a testament of that interdisciplinary, collaborative nature that is unique, I think, to our program here. But to answer your question directly, Jeff, the amount of work that goes behind the scenes on anything, as I've gotten involved in more different opportunities and projects, it's remarkable. Because again, the only thing that people see is the kind of finished end product. They don't see all the meetings and all the late nights and all the time that it takes to build a curriculum and make sure that you're being inclusive and all the research and the, meetings to go through it all and make the changes and additions. So yeah, there's a remarkable amount of energy and time and attention that goes to developing a curriculum.
And Jeff, one thing, just as Joe talks about this, what's been really a bonus too is our students get the advantage of working with persons with intellectual disability. Yeah. The faculty, Joe was at the last Special Olympics that we had, and you were just awesome. All the teaching that you were able to do, especially in things like gait, because we see so many abnormal things that you don't see in the general population, like brachymetatarsia.
Yeah.
I tell people I never saw one in 40 years of practice until I started doing Special Olympics. Now I see two a year or to an event. And so Joe, you were so impressive watching you teaching, but what you saw though was so much of it was communicating with the athletes and or their caregivers. And we'll see as we look at the different, and this is part of the project that we're doing, that people have to realize that some athletes, they're chatty Cathys, they can chat and talk and answer questions, just like you're going, why is this person in Special Olympics? They're just all there in that sense. But then you have some athletes that are essentially nonverbal. And so you have to be able to go back and forth to that and maybe use the caregiver a little bit more often. It's quite an amazing experience to see that.
And I think that so the fact that you've developed the curriculum side, and then they also have the application side, those two experiences are really what help build that skill set. And so I think that that's a really awesome opportunity. And I love that our students were part of that in terms of a driving force, if you will. Again, I commend you so much, Dave, to even now you're creating and developing more new things.
Well, a couple more things that do trying to pull in things that involve our students as part of this chat. A couple of things that are in our curricular project is, so what about the future? What can we do to get other individuals and programs and colleges bought in on all this? And some of the things that we're doing here, because of Special Olympics Arizona, we have something called MedFest. And MedFest is where our students can go and do full history and physicals on persons with intellectual disability that want to be in Special Olympics. And they've worked with Dr. Herrick, who's a nurse practitioner, and PA students, DO students, and podiatry students and nurse practitioner students who have all had physical diagnosis training are able to participate this. And they're going to see things again on the full body physical that you won't see in the general population. The other thing that we have too that we just did, and I want to shout out to Dr. Toms, who was a big part of helping, she's faculty here as well, was where we had standardized patients who were Special Olympians who were trained to be standardized patients. And we had a kind of a test group of about 8 of our students that were able to do a clinical-based exam or competency-based exam with athletes from Special Olympics, and was just groundbreaking. It's a brand new thing. It was funded by 2 Special Olympics by Special Olympics International, and Dr. Toms and Gianna put it together. It was just absolutely wonderful. So that was another thing our students were able to benefit from while they're here. There's other things that they've been able to benefit from because Special Olympics Arizona is so close by. There's Lead the Field, which is where one of the healthcare provider students can be connected with one of the athletes, and they meet periodically and talk about the health challenges that the athletes have when they're out seeing the doctors and stuff. And then of course we have ADMD Club, which is a national chapter here at Midwestern for all students, not just podiatry. It's this with the turnover with Alicia and Nikki heading off to clinics, the people taking over are probably going to be a couple of dental students, which I know already they're just wonderful. They're going to do a great job, and they have lots of events. Down Syndrome Day, they put on a great event. They had someone we're going to talk about a little bit later, Montana, come back and do an ASL course for 100 Midwestern students that was part of the ADMD Club. Of course, Montana's in a residency, just started. So it's been a wonderful experience for our students to be here and join with that intellectual disability training.
Dave, you and I have talked about this in the past, but hopefully these efforts putting forth an intellectual disability course could find its way into our profession's curricular guide, sponsored
Mhm.
by the American Association of Colleges of Podiatric Medicine. So it has
Sure.
broad reaching implications.
And what you just said is the number one reason that if you talk to med schools, pod schools, whatever, why they don't have it, we don't have any room in our curriculum.
Right.
And I get that. We know that as well as anybody. Where do we put this or that? Oh, that's a great idea. Who's doing complex regional pain syndrome? Where's that in the coursework? So, but we have to change that. We have to change that. Just a sidelight. Again, Gianna put on a wonderful conference that was local in Phoenix, relating to all this type of healthcare for persons with ID and other disabilities as well. And there's a Dr. Bassford down in Tucson at the U of A. And what she's created is a program for family practice residents, just like what we're doing for general healthcare persons, but it was just for residents, and it's part of their primary care residency. And so we're stealing a little good stuff from that too. We're taking stuff from wherever it's good, including Special Olympics.
That's fantastic. Any thoughts on that, Joe, before I move on to some research stuff?
Before we get off of sports med,
Yes.
can I ask him a question as well?
Of course.
So one of the other things, Dave, that I didn't realize you had gotten involved in at one point was working with the college athletes at the Exos facility. Can you talk a little bit about what that experience was like?
Sure. And that's another, I guess, Dr. Paige bonus when I got here. And I was doing the sports medicine thing, and I'm trying to think, Larry Olaf. You guys know Larry Olaf. He's up in the Bay Area. He was the team podiatrist for the 49ers and Stanford and, the Giants, the whole deal. And he called Jeff Page and said, I can't be down for spring training. Do you have somebody who can maybe look in on my guys for me? And so Jeff volunteered me. So all of a sudden there I am at the Giants, San Francisco Giants training site. But it was primarily minor leaguers. Okay. I was still doing stuff. And a lot of it's pretty basic things, ingrown toenails and orthotics and whatnot. But this was at a time when Randy Johnson was there. And I saw him walking through the locker room. But anyway, long story short, suddenly the Dodgers needed somebody. They needed a podiatrist to be there for spring training. So the trainer from the Giants said, well, we got this guy over here, Dr. Jenkins, maybe he can help you out. So that started the Dodgers thing. I did that for 7 years, and that was with the real deal. My first patient was Matt Kemp. I saw Clayton Kershaw. I got to see Rafael Furcal, Joe Torre, Andre Ethier, who is my favorite because he was born and raised here in Phoenix and went to ASU. It was just an absolute joy to go there on a regular basis, to get to see these guys and just have, full reign of what they just say. We want you to fix this, do this, do that. And it was a consultant. I didn't go to the games because they were obviously in all the other cities and stuff, but everything spring training was what I got to do. And then the Exos thing, how that came about, it was called Athletes Performance back in the day, was one of the trainers at the Dodgers. Her name was Sue Falsone, and she also worked at Exos. And she was the first female head trainer for any major league team, whether NBA, Major League Baseball, et cetera. And so she was able to kind of share, hey, this guy can maybe help out with some of the things at Exos. And so that's pretty much, I got to see Brock Osweiler was one of the people I got to see. And trying to think, Damaris Thomas, who sadly has passed, he was another one that we got to see. Eric Decker. And these guys got to go to the clinic across the street to be, fitted for orthotics. And all the people working there looking around the corner to see these guys, they were just so cool, so nice. They kind of broke the mold of the, snotty professional athletes. They were all very kind and nice and fun to work with. And I even had some students that got to help out with that, go to Exos. Samantha Price, she was one that got to go cast Buck Osweiler with orthotics at that time. And it was just, what a joy that was. And so that's, I don't know, Jeff, that's kind of what you were talking about. But.
Yeah, and I bring it up because literally this morning we were in anatomy lab this morning, Dr. Jenkins and I, and we were obviously there. You're with the posterior compartment. We're talking about gastroc recessions and various surgical procedures. And one of the students was asking about opportunities in sports medicine. And so
Mhm.
again, it was just that beautiful opportunity to kind of highlight your experience as a multifaceted sports medicine doctor, from
Sure.
college athletes, professional athletes, Special Olympics, the American Academy of Sports Medicine as a president, past president. It's just like, again, I just wanted to kind of have the opportunity to highlight those things.
And there's a whole lecture on that process in the sports medicine, and it's basically the the athlete as a patient, and so go through that whole process that we start out with your kid's soccer team. That's the very first team podiatrist that I was. And I tell the students the story that I was also the owner, not the owner, but the sponsor for my kid's soccer team. So they're all running around on the field with Dr. Jenkins Foot and Ankle Center. This is at Davis. And so this is a true story. I'm standing next to a bunch of moms, and they're watching the kids go back and forth, basically magnet ball, right? And so it's going all, and this woman goes, Jim's been having some foot trouble. Do you know any podiatrists in Davis? And I'm standing next to him, and it's like, your daughter has my name written on her
On your shirt.
So anyway, it's just kind of you gotta do that marketing.
I love it. Well, that talking about the students, Dave, is a neat segue into this next discussion that I would like to have. You have had a special relationship with research and involving students for such a long time, because there's a lot of docs, a lot of professors that like to do research, but they don't always like to involve students, right? And I think you have been a phenomenal example and mentor to the rest of the faculty in trying to get research projects going that can get published, that are wonderful projects, but they involve the students at a high level. Can you talk about that a little bit? Because what you've done is amazing at our college.
Sure. And this harkens all the way back to when Dr. Paige was here. And most of these projects, not all, but most of them are students that walk in my door, sit down and say, I want to do research on skateboard shoes. Or in the case of Bryn, who was a student back class of 18, she said, I want to do a thing on rock climbing shoes. My sister is a professional rock climber, and I thought that would be cool. So that was one of the very first student-generated things that I did, other than Special Olympics. I'll come back to that in a second. But as I mentioned, skateboard shoes, one of our recent graduates, she came up with that idea. Another student came up with the idea of when is it okay to go on point? So that project, and these are all students that have walked in and asked these questions. We have a student who wants to do something on adding bicarbonate to local anesthetics. I mean, one of our former students, she was sort of the queen of high school days. She ran a bunch of high school days and wanted to do something on what do college kids versus high school kids know about podiatry, and that article was just accepted for publication. Another student, and sometimes they'll come in right before their third year rotations start. It's like, why are you coming in so late? And one of the students came in and she was same boat, and she said, this is where I came up with the idea. I had taught for years in the vet school, and I mentored a lot of vet students, and my topic was search and rescue and dogs that do that. And so this one student, her project though, it was diabetes detection dogs. Of course, diabetes is a big deal in our field. And so she had done a wonderful poster and wonderful PowerPoint on that topic. So the student that came in, I said, well, how about running with this and do a whole paper on it? So she did, and that was another one that was accepted earlier this year. It's supposed to be published in another month or two. And then to follow up that, a student after her kind of got on the dog bandwagon, and now she completed a paper on dogs that eat diabetic foot persons with diabetic foot ulcers that are neuropathic and have no idea that the dog is essentially debriding their foot. And we're hoping that will get accepted and published very soon too.
The irony of that is all of a sudden case studies started coming out of the woodwork.
Mm-hmm.
Our students were rotating around the country, and we heard the same story over and over.
Well, this particular student for the diabetes detection dog, she was on rotation, and we'd already been told by a reviewer, well, nobody cares about this topic, and everybody knows all about it, and it's not of interest. And my student who's rotating down in Tucson, she was talking to an endocrinologist specializing in diabetes. And this endocrinologist said, we're not having much luck with this patient with the glucometer. Maybe we should think about a diabetes detection dog, but I don't know anything about it. So we put that in the reply to the reviewer. And also the fact that her talk was the most popular talk pretty much for the KAS that year. So hardly not an interesting topic.
Joe, your thoughts on the student research? I mean, I know you're doing a bunch of projects with the students. They're so creative. They're so innovative. They bring a lot to the table.
Yeah, and I'd like to make a little shout out to our students. I don't know off the top of my head how many, but we just had at least a dozen student initiated research scholarships, which so proud of all of them. They have worked so hard, and very much mirroring what Dave says. It's so exciting to have a student come in and they kind of know something, but they don't really know what to do with it, or they're like, I'm kind of interested in this thing, but I don't know, is that a thing? And it's like, well, I don't know. Let me kind of give you some of my thoughts about it. And then you tell me what you think is interesting from that. Or, oh, that is interesting. I don't know much about it. And we kind of start doing a little bit of a dive. And it's like, oh, this is actually really like the diabetes detect. This is really interesting. Let's do it. Right. What is harder is as they are on this revolving basis, just like Dave said, if you come in your third year, you don't have a lot of time to really invest. So that first couple months or first quarter or semester, I suppose, depending on what school you're in, it's hard to get involved because you're just getting your equilibrium of what med school, pod school is like. But then even if you don't know what you want to do, like I've had students come in like, I don't know what I want to do, but I want to do something. And you can kind of just float some ideas or, say, okay, well, go find a couple topics that you might be interested in, or, what fields are you interested in biomechanics? Are you interested in sports medicine? Are you interested in surgery? And then they can start to kind of help you, give them some things to kind of work with. And it's such a fun kind of back and forth experience. And I am so impressed with some of the things that they've walked in, like, oh, I saw this. We have a student who is currently in a project that was interested in a topic that she had gotten inspired off of something from a social media post that she was like, this is so interesting to me. And she wanted to do something similar. So we ran with it. And I mean, she's brilliant. She's just knocking it out of the park right now.
Yeah,
so it's really exciting.
We are blessed. And I've noticed this is a trend more recently, that students are either more prepared with research. And I'll give you an example. Joe and I were in anatomy this morning, just wandering around. I like to do clinical stuff. I don't want them to ask me where the piriformis is. So, but I'll get in where they were doing deep posterior compartment and the posterior compartment general. And I started talking about exertional compartment syndrome because I said, this is something we'll talk about, in sports medicine next year, kind of give you a little preview. And I'm talking about, and they go, oh my God, so-and-so over there, he had a compartment syndrome. Well, it turns out it was a tib-fib fracture and it was an acute compartment syndrome. So I went over to him and I said, next year, you're going to tell your story, although it's more apropos to Dr. Richey's course, because it's trauma, whatever. But this one guy, we're talking about it and he goes, well, what about people who maybe take steroids, and they get all bulked up? Because I was talking how muscles, if they're too big inside the compartment. And I said, that's an awesome idea. Go look it up and get back to me. See if there's anything out there. Because I don't know, it could be a wonderful topic to study, but that's how it starts. That's how it starts. I got to jump to this because I don't want to leave it out. It's so important. It's what we're going to talk about at the academy with Kathleen, and that is fit feet. As Joe knows, we've never had a vascular study. We've never done neurological study. It's all been put aside because, well, the athletes, they have perfect pulses and neurological. That's not true, obviously. But we didn't do a Sims-Weinstein because there was a thinking that the athletes don't know how to do that test. They won't be able to follow it and do it. And I didn't think that was true either. So a couple of our students, Hannah Montana, we call it the Hannah Montana Project, which is kind of cute. They designed a study that we did at Special Olympics Arizona, where we did a Sims-Weinstein on about 35 athletes, not to see what the results were, but to see did they appear to be able to understand how to do the test from our viewpoint. We had a whole list of criteria, and they think that they thought that they understood it. It was like 70, 80% of them we thought fully understood how to do the test. So that experience, that study, that research is something that has changing the entire fit feet exam. We're going to include pulses. We're going to include protective sensation. We're going to have a whole assessment for risk for diabetic foot ulcers, because we found that diabetes is about 4 or 5 times higher in the intellectual disability population. So it was a springboard for a major change in fit feet.
You know, I think
Those young ladies just did a rock star job of that.
they're phenomenal. So I wanted to just bring up another point. It's kind of a shameless plug for the Arizona College, but on these research grants, I think there's been 71 students the last 4 years participating. And while they do a deep dive and they do literature reviews and gap analysis and they're writing papers and they're working with our different faculty that are experts in different areas, it really sets them up for residency opportunities too.
Mm-hmm.
And I always say, you know, if you go into a residency interview and the residency director starts asking you questions about your research study, you can't get the answer wrong.
Mm-hmm. Mm-hmm.
Joe, you've seen a lot of residents or students come through when you were a resident. Did you find that to be true? I mean, it's a different level of student.
Absolutely. And, you know, the other thing that I've told some of our students here is, again, depending on where they are in their training here, I may be able to help them start to shape an idea that they can take into residency.
Right.
Because if you can show up on day one and you have access to a health system or a research department that can help you, within your 3 years, you will definitely be able to complete a project. What's hard as a resident is you may be getting your feet wet and now it's your second year trying to get stuff off the ground. Sometimes all of these things just take time. So some of the things that's been, again, as I've been learning how to mentor students in research, it starts to come down to figuring out what are our objectives for this while you're here in school. And then how could you build on that if you chose to later on, when you have maybe a different set of like access to records and stuff that would be easier to do bigger type research papers. And so that's been a fun process to see them start to get excited, and you can see it in their eyes when they start to realize, like, this is what I'm going to go do. And it does, and I think we all benefit from research, especially well conducted research. So having the opportunity to start that process as early as you can. And actually, a lot of our students come in with undergraduate and master's level research where they know more about some of these like REDCap and some of these survey things. And so they're a wonderful resource to each other. Like, you know, we have some students that are helping each other with things. And so again, it's a wonderful opportunity to be involved in. And in terms of setting yourself apart as a student, looking at programs, one of the common things we found and again, I don't know now since I'm not affiliated with the residency program currently, but the biggest gap on a application was the research. Or it's like a research project and you're one of like 7 students on. So like, well, what did you really do on that project, right? So I think it's neat that there are so many opportunities here for students to do their own project, jump in on a project that's already been going. And so many of our faculty have research going, and Dr. Jenkins, Dave is obviously a huge driving force for that. And I know the students really love working with him.
Yeah, the KAS is a fantastic experience with the students all dressed up and with their posters, and I guess the people wandering around, the judges are coming around asking them questions. And as you know, Jeff, the curriculum project was invited to be a poster with the I guess it would be Dr. G and the Board of Trustees. And it was very, very incredible to see the Board of Trustees. In fact, the chief, not Dr. G, but I guess the head of the Board of Trustees spent 15 minutes asking questions about it. Was very, very impressed. And it was just a wonderful experience, not only for us, but for I think for our college too, to be included in that.
You know, when I saw the review of all of the posters, and you're referencing the KAS, Kenneth A. Suarez Research Day, I believe we had 17 posters from our college this year alone. And a lot of them were yours, Joe's, the rest of our faculty. And this is not going to slow down anytime soon, because I'm looking at the board behind you, David, filled with research topics. No shortage of research.
All the way back to the diabetes detection dogs.
Oh,
and then there's been a number, and these are current. It's obviously not the ones before that, but the ones that are we didn't talk too much about were just the general Special Olympics, what we call prevalence studies. You know, how many athletes have shoes that don't fit, or how many athletes need a referral, and you know, what are those referrals for, and are the referrals urgent? How many have bunions? How many have flat feet? You know, kind of cut and dry statistical stuff, but it's still we've had 4 of those types of articles published already. One was just accepted a few weeks ago and is actually already published. And it's ironic, not ironic, but it's super cool that one of those first articles was with Dr. High when she was a student.
Oh my gosh.
And that's where we compared Athens data to USA data. And that was the first one that we did where we compared an international to a US data set. And she was very helpful, as well as Dr. Richey, in getting this recent one through, because they gave us all kinds of hassles with the reviewers, but they stuck with us. And your suggestions were well taken, and then we got to the finish line. But it just shows you what goes around comes around. That, you know, because I remember Dr. High, she was like, when the first reviewer was kind of bashed us pretty good, and you know, you get defensive. And that's totally normal. I said, just hang in there, just do what they tell you to do, and you'll be fine. And that's what happened eventually with her paper. So
Research is such an exercise in delayed gratification. I mean, it really is. And I mean, if Dr. Evelyn High Rosen, who's with our faculty now, started working on this as a student, I mean, my gosh, think how long that took to, you know, come to fruition. But it's worth it. It's definitely worth it.
yeah, she did that when she was still a student. It got published, I think, when she was a resident, though.
Right.
Still, that's incredible to have that happen so quickly.
Absolutely. Well, Dave, this has been so much fun talking about all these different aspects of your career. I know that every year when I look at all the different things you do, it's like pages and pages, and it's hard to keep up with you. Joe, anything on your mind to finish up here?
I do have one last thing that I would be remiss if we didn't talk about. You talked about diabetes dogs. We can see in the back, you have a dog. You've worked in the vet program. Could you talk just a little bit, maybe? I know we only have a couple minutes left, but can you talk a little bit about the work that you do with search and rescue?
Right. Yeah, I did want to at least mention that, because from 2009 to 2019, I was a member of Mark 9, which is the Maricopa County Sheriff's Office Canine Search and Rescue. I'm no longer with them, partly because of Special Olympics. I got that consultant job, and I just couldn't do both. Julie would kill me, my wife Julie. So I've kind of phased out of that. And Vader, my search and rescue dog, he passed in 17. In fact, he passed the day before I drove you around, Jeff, for the tour of campus.
I remember.
How I kept together, I don't know, but it was just an absolutely wonderful experience. And where it ties in with us, and I'll finish with this, is that we had, I think, five years in a row that we did a bone lab, where we set up at various locations, from a classroom all the way to the beautiful lab over in Cactus Run vet lab, where they have essentially a full-size skeleton of a cow and a horse in there. We had 50 law enforcement individuals that would come from the FBI, Phoenix PD, all over the place, SI, just amazing number of individuals. But the best part was I had maybe 7 to 10 students who were the TAs for this. So they stood at a table with maybe 8 femurs, you know, one is human, the rest are animals, and explained to the attendees how you can tell an animal bone from a human bone. And Dr. Townsend, who's an anatomist here at Midwestern, incredibly helpful. I mean, way above my pay grade is being able to determine what animal it is, and what bone it is. And so, but the students were just absolutely fantastic. And I even scored a giraffe femur. It's huge, as you can imagine. It weighs a ton, but it just kind of shows you, you know, you compare that to the human femur, and they can easily see which is which.
Absolutely. Now, what a service to the community, Dave. Those were incredible events. I remember going to them, and the participants, whether it was the police department or search and rescue, were all just so enthralled and so into it. It was fabulous.
The whole state was invited.
Yeah.
It was from every part of the state. And like I say, it was a huge endeavor. In fact, I ran into Ashley in the anatomy lab today when we were there, Joe. And she said, when do you do bone lab again? Because it's been a few years. COVID kind of wiped it out for a couple, 3 years. And I said, I just don't know if I have the wherewithal to put that together again. It's such a lot of work. And Dr. Wisman, I should do a shout out for him, incredibly helpful in the bone labs with his anatomy experience. And he knows all the people at anatomy and get that human bones for us and stuff. But that was a great time to do that. And Vader would come to the event and greet people and stuff. And so, but thanks for asking, Joe. It's one of those really happy times.
Yeah. It's a fun fact about you.
Oh, it is fabulous. So David, one more question for you. Let's talk about your favorite bands. You're a big music guy. Who are your favorite bands of all time?
Besides the Eagles?
Besides the Eagles. We went to the Eagles together. Dr.
Jensen and I went and saw the Eagles with our wives and Ashley's mom and dad. Going back, because when I was in pod school, I went to all the Days on the Green, which were at the Oakland Stadium. Greatest concert ever, The Who. Just absolutely amazing. Loved Linda Ronstadt, the Beach Boys. I mean, all these amazing groups were at that time. Leonard Skinner was another big band at that time. Joe Walsh, when he was by himself back then. Currently, I'm not as into the music scene as I was back then. I don't think the music today is quite as good as it was in our day. Led Zeppelin's probably right up there with my very favorite groups. I don't know, it's kind of I need to research that one better for you.
We went to the Doobie Brothers too. We went to the Doobie Brothers.
Yeah, we saw the Doobie Brothers also.
Yeah.
So some of those, Santana, I saw them 3 times when I was back in high school and college and stuff like that. So just those groups were, I think, the very, very best. Saw Eric Clapton. It was my son's first, I guess, musical get together.
Sorry, Joe. It's like a time machine here. We're going back to the 70s and 80s.
No, you're good. And it's also one of those little things people don't know about Phoenix. There's actually a pretty good music scene here. Like there are bands that'll come through on their way between, and you can see them in really small venues, which is really fun. So little Arizona plug. The culture scene is better than it used to be.
Very good. All right. Well, Dave, thanks so much. And Joe, thanks so much. It's what an enjoyable hour catching up on your career, Dave. Thank you.
I have one. I have like 4 of my things.
Dave, we have a better one now. Hold that up again. We've got the one you're going to get now has both Joe's and my name on it.
That's
awesome. Fantastic.
Yep,
so you have us back for Special Olympics again, okay?
We will always have. You've got an open invitation. You know that. Absolutely.
Yeah.
Awesome. So much more to share.
All right. Sounds good. Well, to all of our listeners out there on Apple Podcasts or Spotify, please give us a 5-star rating. We so appreciate you tuning in to listen to Dean's Chat every week. And then if you're on YouTube and you're watching, please become a subscriber. And until next week, cheers, everybody.
Cheers.
Bye-bye.